Hey guys, welcome back to the summer courses. We will be diving into modalities. This will be a 4-week course, so there'll be a lot of material to cover. So I'm going to record some of the lectures so that you can listen to them at later dates and in between class times and maybe even on the weekends because you just love us so much. Ha ha ha. But for real, it's just a lot. So we will cover my whole course in 4 weeks. There are 2 tests and a lab practical. So it goes really fast. I may try to make some quizzes and throw in there just to give you opportunity to cover a little bit more material and make sure that you have them. The more that you do outside of class and being prepared for class, the more we will be able to do things that may help you to learn. So that's one reason why I am recording this for you. All right, so chapter 1 is about evidence-based practices and how important evidence-based practices is to our field. First of all, let's talk about what evidence-based practice is. Evidence-based practice is just the use of the best and current evidence to assist clinicians, whether they're doctors, nurses, physical therapists. The whole realm benefits from evidence-based practices. And this also benefits the patients because they're getting the latest treatments. Medicine has evolved. Think about 20 years ago, things like dry needling, and one thing that we'll talk about is force boards. Those are really new right now. Restrictive blood flow exercises, that's all new, and it come off of evidence-based practices. And you'll learn more about these topics, especially during the fall. But that's because there has been researched, and it has been compiled, and it's been tested and verified, and so it's really important to always be up to date about what's new and what is the latest, and then finding out whether the outcomes are as they say they are. These evidence-based practices, or EBP, they just help us make the best clinical decisions that we can for our patients. So from a patient's perspective, do you have to go to school to learn how to do this? Well, there are some things that you can be trained to do in the clinics, and techs will be trained to do a minimum scale or role. If you go into a clinic that the tech looks no different than a PTA, you need to run. You need to find a different employer, and you will see that, and that is just a very sketchy, iffy place to put yourself in, because there are things that we are trained to do to catch that may have been overlooked. And if you have someone, say, perform an ultrasound on a patient and they didn't ask them did they have a pacemaker or have they had active cancer, and even though the PT has instructed them to do it, if they do that treatment, then that patient could have adverse effects. You could make it worse. You can make their pacemaker stop. There's a lot of things that you can do. And so, yes, you need to go to school to learn how to do this and to be safe for the patient. Also, a tech doesn't understand how to be effective. If you're just doing the same treatment and the patient's not getting any better and the PT's not putting their eyes on them, then you may do 20 treatments of something that you shouldn't have done. And so you've been wasteful and you have discredited our field. So that's why we just really need to be proactive about protecting our career, what makes us valuable. And then the other thing is you constantly need to be making sure that you are staying up to date with what's going on. Here are our learning outcomes, so we're going to go over these real shortly, but let's just think about how this evidence-based practice could really help or hinder. All right, so you have, say, a grandmother, a mother that's gone to the doctor, and the doctor has prescribed this blood pressure medicine. And you know how you've watched the commercials, you see how the medicines change all the time. And so, say you ask this doctor, say, hey, what does the current literature, what does the current evidence-based practice state regarding with this medication and her being so young? And if the doctor can't answer that, then are you sure that the medicine is going to be appropriate? Are you sure that the medicine is going to be safe? What does that say in the minds of that family about that physician. All right, so say the family decides to go get a second opinion, and whenever they ask the same question, that doctor is able to refer 2 articles regarding the safety of the medicine, the effectiveness of the medicine, and what possibly might be the side effects, especially since she's in childbearing years. Which doctor has more credibility? Which doctor are you going to listen to? And which doctor do you think has less litigation against him? Very important to think these things. So we need to be making sure that we understand what's going on out there and how this all affects us. So in the same scenario, we're going to talk about how was the use of EBP influenced your confidence in that doctor, or how did it influence the treatment? I mean, we've seen those doctors that's been out since the age of Methuselah, and they're still prescribing the same medicine because they don't know that there's better medicines, and there's medicines that don't have such harsh side effects, or there may be medicines that can treat 2 different comorbidities, and so there could be a better, more efficient way to treat that patient. Now, not to say that all of that old medicine is bad, but are you staying up? Can you defend your stance from where you're coming from? How does not staying up to date with evidence impact a clinician's ability to make safe and effective decisions for the patient? Well, if you're not staying up to date, you don't know what is out there. You don't know what research has been done to disprove your medicine or to prove your medicine. You're not understanding the technology that's around us, and so your practice in general would just suffer because they're like, that old coot of a doctor, he's been doing the same thing as from years ago. So we need to make sure that we're not getting that discredibility by not staying up to date, not having knowledge, because patients, half of their fear can be resolved with education. So you need to make sure that you're constantly getting good education so that you can get them to buy into what you're trying to sell them, buy into the treatment that's going to get them fully functioning, and to make sure that you're doing the most effective and safe procedures for that patient. You know, what type of clinician would you prefer to be? You know, when you're practicing physical therapy, do you want to be the doctor that didn't have any answers, or do you want to have the doctor that was knowledgeable and that is current and that is effective? So it is important for us to stay up to date. So the vision statement of the APTA in 2020 was guided by integrity, lifelong learners, and a commitment to comprehensive and accessible, comprehensive and accessible health programs for all people. Physical therapists and physical therapist assistants will render evidence-based practice services through the continuum of care and improve quality of life for society. So what does that mean? First of all, we're going to have integrity. We're going to have honesty. We're going to have respect. So we have to portray that. We have to know that. Lifelong learners. Just when you graduate 2 years from now, you're not done. You should continually learn new things and strive new things. Get those from other clinicians. Get those from research. Make sure you're doing the best treatments out there for your patients, and make sure that they're based on not what I think is great, but this is what I know is great. And so that when we do those things, we're going to improve the quality of life for many. So why should we use evidence-based practices? So we need to be using evidence-based practices because it is an approach to combine clinical decision-making skills, but also that we're integrating that best research. You know, we don't have the time and money and effort to go research everything. So thankfully there are people out there that really love that, and different organizations that do that for us, so that we have access to the most current research and evidence. But then we need to have clinical expertise. And so clinical expertise is just your proficiency. You know, how well can you deliver treatment in a facility? What are your abilities? Do you provide them safe and effective? So we've got to have evidence-based practice, we've got to have clinical expertise, and then we have to take into account what are the patient's values. What do they want? What you want and what they may want may be two different things, and it's okay. So we have to take that individual patient and create our treatment around what's important to them, what's going to motivate them, what's going to make them the most independent, because every patient is not the same. So evidence-based practice is a conscientious, explicit, and judicial use of the best and current evidence in making decisions about the care of an individual patient. It is really like a state of mind, like constantly trying to figure out how to be a better clinician each and every day. So it's important that we stay up to date with what's going on. So why should we use evidence-based practices? The primary reason is it benefits our patient. We treat them more efficiently. What was assumed to be the best practices, 20, 30 years ago, may have been that every patient would end up needing 20, 30 visits. Well, the technology has cut that down, that we don't particularly need all those visits sometimes. So we need to be the most effective and ultimately lead to improved patient outcome. We want to improve the quality of care for that patient. We want to improve our credibility as a profession. One of the things that we want to do is we want to maximize reimbursement for physical therapy services, and you'll hear this more and more as you get out. There has been an ongoing kind of battle between your payer sources, whether that be private insurance, Medicare, Medicaid, those type people that are setting the reimbursement scales. And so if we're not providing credible care, then there is a potential that we're not going to get reimbursed, because they're going to say, well, you're no different than a personal trainer in a gym, except we really are. And so we need to make sure that we're using those evidence-based practices to justify our services for reimbursement and provide better outcomes in the most efficient manner. And so by doing all of those things together, we're going to increase our credibility of the profession, and we're going to sustain our profession. So make sure that you are what's building your profession, not tearing down your profession. So there are 5 steps that we can look at, and if you want to look in your book on page 4, I'm just kind of going along the book, so you can look as we go, but there is a heading. It says the 5-step process for implementing evidence-based practices. So what are those 5? So this is important to know. So how do we know if the evidence-based practice is working? So the first thing we're going to do is we're going to be asking an answerable question. So when you're looking at your patient and you're thinking, okay, we'll take dry needling since it's kind of new, can this dry needling improve the care that I give my patients? And so that's going to be my clinical question. And then I am going to go and I'm going to acquire the best available evidence that's out there. And then I'm going to appraise that evidence, like, is it what it says it is? Then I'll eventually apply the evidence in a clinical practice. And then finally, I'm going to assess the process. Did the result end up being what I thought it was going to be? Did the result match the evidence-based practices? So let's look a little further. All right, so step 1 is ask. And if you would like to know this, these are 5 A's, and it would be pretty smart of you to learn the 5 A's of implementing evidence-based practices. You will see this in my class. You'll see this in Tommy's class shortly. So you will need to learn these things. So ask an answerable question. So your question should be yes or no. Can I do this skill to make things better? Or like we were saying, let's just say, does dry needling relieve TMJ? All right, that's an answerable question. So I can drill down, I can go through my steps, I can use my dry needling to find out if I can make my TMJ patient better. And and you may find out that it's yes, and you may find out it's no. Each patient is a little different. So you form a structured question that defines the problem, the intervention, and the outcomes of the interest. So the forms question is, can dry needling help a patient with TMJ? So I've defined the problem, and so the intervention is going to be my dry needling, and my outcome is, can I relieve their pain? So when we're talking about different clinical questions, you can do the PICO type formulation, and that's basically you're going to focus on the patient or the problem. What is the patient or the problem? What is the intervention that you're going to use? And then you're going to compare. Did I get the outcome that I thought I was, or did I fall short of that? And then you're going to look at that final product. Did I get closer to treating? Can I become a proficient TMJ specialist? Possibly, yes, no, we'll find out. So, excuse me. All right, so step 2 is acquire. So you're going to have to find evidence in a healthcare literature. So we want to make sure that we are looking in reliable journals and having access to databases. And some databases are peer-reviewed journals, and so we'll talk about a couple of these. And so like Google Scholar is so accessible, so we just have to be careful to make sure that it is good quality information. Medline is one, Pedro, PubMed is a very popular one. So PubMed, Medline, and Google Scholar is probably the ones that you'll see the most of, but they're peer-reviewed journals. So I got to make sure that I'm looking at where my evidence is coming from. And we'll talk about those things also. Excuse me for clearing my throat. So if you're an APTA member, you actually have access to a paid database, and that's part of your membership. So you don't actually have to pay for that, because some of them are paid and some of them are not. And so you can research through their databases. Another thing that APTA does is they send out journals, and they'll focus on one type of ailment or another, or one type of concern or another through the journal. So if you're reading those are real good research for you. All 5 of these peer-reviewed journals listed here are all free, so you don't have to pay for these. So that is important. All right, so we've asked, and then we've acquired information. So now we're going to appraise. So we're going to evaluate the evidence that is in the healthcare literature. So we're going to have to think about, is the evidence strong or is it weak? You know, how many studies were in that evidence journal? You know, was it 5 people said that that was the correct answer, that was the correct process, the correct outcomes, or was it 500? You know, what was the time span of the research? Was it 6 weeks, or was it 6 years, or was it 60 years? It all makes it more reliable or not. So we have to really think about, how did they, what was the research design? What were the subjects? What were the stats? What were the biases? You know, if say one of the different manufacturers, say Johnson & Johnson, does research to show that certain medicine, let's just say a blood pressure medicine, works better for this type patient. Well, if they're selling it, then they may have biases to it. So their research may be non-biased, and so that may skew the numbers, because they want to make sure that it says it does a real good job, because that way then more people buy it, and then they end up making more money. So we need to make sure that we're looking at those things. So when we're reading these journals, we need to make sure that we're reading more than just the abstract and the conclusion. We need to look at the process. How did they validate their research? You know, what was the study credibility? And that is on us as clinicians to do our job. So when we're evaluating the design of research, there's a hierarchy. And so this is an example of how the hierarchy looks. So if you will notice, right here at the top, systematic reviews and meta-analysis. Those happen to be less biased than editorials and expert opinions. Well, you would think that expert opinions would be the most reliable. They would be the least biased, but not necessarily, because if that expert is paid by Johnson & Johnson to say that their blood pressure medicine is the best, then they may be more biased, because if they give good reviews and they sell more products, then Johnson & Johnson may ask them to do more. So when we're looking at this hierarchy, it's really important to understand how, when we're reading specific journals, which ones are more reliable than others. So systematic reviews and meta-analysis, if you pull something off at the APTA website, that's a great way to get meta-analysis, or a great way to get systematic reviews, because it's been used in multiple researches to bring more and more reliability to the research. So let's just go through and look at the ones that are least biased. That means that they're going to be more credible if they're least biased, because if I'm biased, I'm going to want it to go one way or the other. So systematic reviews, meta-analysis, randomized controlled trials. So that's really important. It's randomized. There's no selection process. It's very controlled when they do these trials. So they pick say there's 50 women in a room, and they just choose, let's just say they choose 10 of them. And there's no rhyme or reason. They just randomly pull their names out of a hat. And then they're going to make sure that they do take their medicines at a certain time. They're going to make sure they weigh at a certain time. They make sure they take their blood pressure at a certain time. And so all this criteria is there. Cohort studies. So that would be people that are your colleagues that possibly want to do a study. So they're kind of in the middle. They could be pretty reliable, but as you keep going down, you'll notice, this is impressive, that case control studies, case series and reports, and editorials are actually the most biased, because most of the time you're going to have, as my grandparents used to say, you're going to have a dog in the hunt. And that just means that you're going to want it to go one way or the other, because you want to prove that your material, your clinical skills are good, and so you'll be more biased. So that's an important thing to understand when you're looking at it, and knowing that systematic review and meta-analysis is going to be the most reliable. All right, so let's get back on to so we're on our 4th A. So we've already asked an answerable question, then we acquired evidence, then we appraised that evidence to make sure that it was legitimate. So, of course, that's us saying that a systematic review is much better than an expert's opinion, which is probably opposite of what you thought. Now we're going to apply. We're going to find a way clinically to put it into our treatment. So we've gotten this knowledge. We've got a patient with TMJ. We want to do dry needling. We're going to be very specific about following a plan from what the evidence shows to see if that patient gets better. And so we're going to see how our values after the end of the treatment look. And then that's the 5th step, is you're going to assess at the end of 10 treatments, how is your patient's pain? How is their range of motion? Does the pain come back over and over again, or do we see it slowly weaning away and not coming back as strong? And are their headaches more manageable? So those are the type of treatment outcomes. We want to compare those results of your patients to what you had before and what you had after. And that's going to let you know whether that was good evidence-based practice or not. And then you're going to start thinking, okay, how can I be more effective with it? Can I apply this to other patients' pains? How can I integrate that knowledge that I've just learned into a new area? right, sorry there. I didn't realize that I had done that, so there's kind of a pause. Forgive me. So let's talk about the different types of evidence, the biases that may happen and things like that. So experimental designs, and that is just when researchers place the subjects into 2 or more groups and keep all variables the same except for the one that they're testing. So in an experimental design, what you're going to say is, okay, I'm going to take my TMJ patient, I'm going to apply my dry needling, and for this one, I may decide to use a certain ampage on patient type A, and then on patient B, I may change that ampage and see which one actually feels better, which one gets more results. So that's an experimental design. That means that you really don't know, but you're going to tweak it out, and you're going to see if there's something a little different from one to the other, and do you get better outcomes on one than the other. Variables are characteristics that can vary from group to group. I can decide that. So there's 2 types of variables out there. There is a dependent variable and there's an independent variable. A dependent variable is a variable that can be measured. That's all that means, is it's dependent. I have to measure it to be able to know what that is. An independent variable is what am I trying to say? I kind of lost my thoughts for a second. Is a variable that is controlled by the researcher. I'm sorry. So the independent is set by whoever is researching. All right, so we talked about the experimental design where we decided that we were going to try group A with this ampage and then group B with this other ampage. But a non-experimental design means that you do not manipulate the subjects, that everybody gets the same treatment across the board, and we're just going to see what the results say at the very end. A systematic review or meta-analysis is often combined by trained reviewers, and they gather like mini studies. So some of these experimental, non-experimental designs may only have 50 subjects or 30 subjects or in the whole research base that they're presenting, whereas systematic review and meta-analysis is multiple, like many, it may be hundreds, and it may even be thousands. It just kind of depends on what the question is and what the research is. So it is a vast overview of multiple, and so the more research subjects you have, the more often that information is going to be more reliable and more true. All right, so let's just talk real quick about the different kind of subjects that could be involved. So a research subject is the people that the data is collected from. So that would be your patient. They would be the research subject. And so to do a study, you've got to have some sort of criteria that is kind of the parameters. Like we will test the subjects that either fall inside or outside of this criteria. So an inclusion criteria is just the characteristics that the researcher sets that says, okay, I want to test women between 20 and 45. So an inclusion criteria means that anybody that I test that's going to go through this research analysis is going to have to be within that time frame. So that's an inclusion. So we're going to include them. But then we can actually put some exclusion criteria on there. So you could say, since we're in childbirthing years, between 20 and 45, we can say that those women can't be pregnant. And or we may say something like that the patient has to be under reasonable stress. So the exclusion may be if they are in some kind of CEO position and they have a lot of stress, they're going to have more stress than other people, and so that's going to cause them to probably have more TMJ pain. So we're going to exclude them because it's going to skew our results. So that's an exclusion criteria. Anytime you're doing research or reading research, statistics is really important. And if you've never taken even at least intro to statistics, that's a good place to start, because you'll be able to read the documents a whole lot easier, the symbols, and understand what they mean. But statistics are just tools that researchers use to determine and evaluate the data that they collect. So it's a systematic way that they understand that if X plus Y divided by the sum of X equals whatever it is. And so that sounds real complicated, but once you've taken an intro to stats course, then you understand, okay, they're just saying this, and so it will just help you. But statistics, it's really cool. They are true to themselves. And so over the countless years that statistics have been taken, they are constantly true to themselves. All right, so let's go to the next Think, Pair, Share. So here is just another example of ask an answerable question. Find evidence in the healthcare literature that says that this treatment would support your question, and then you're going to evaluate where you found that and how evident is the material, how reliable is the materials. There again, I told you that an expert's opinion is actually extremely biased. So if I'm reading research that is given by an expert, then I'm going to know that there's a likelihood that that is not real reliable. But if I go to something like the APTA and I read a meta-analysis on that, then I'm going to know pretty sure that it's going to be very little bias. So that's going to be more reliable. Then I'm going to actually use the evidence I've collected, and I'm going to start to find ways to integrate that into my clinical skills of that patient. And then at the very end, we're going to have to make sure that we look at it and we say, okay, this is where my patient started. This is where it ended. I thought they would be at the next location. How close did I get to what I thought? Am I really close? So that lets me know that that was good evidence-based practice. Or did it not help? I may need to keep researching and seeing if there is something else out there. When you get out in the work world, it is very important for you to surround yourself with clinicians that are looking for evidence-based practices. And that's going to be a very supportive work environment. So it's really important to challenge your coworkers to learn. If you look at table 1-2, that's on page 8, that just gives you an idea again of how to ask, acquire, appraise, apply, and assess. This one happens to be about an African violet. The answerable question is, how do I keep an indoor African violet plant alive? So then you're going to acquire the knowledge. So you're going to ask a neighbor who already has one. You're going to read a plant journal. You're looking at the American Society for Horticultural Science and maybe a sales associate at the local plant store. So they all have access to information. Then you're going to appraise. So which source has the best expertise and which one has the least amount of bias? So in this situation, the sales associate at the local plant shop may be extremely biased, and they may tell you something that makes you want to buy more. They're probably credible and they probably have some ideas, but ultimately they want to sell more African violets. So we need to make sure where we're getting our information. So the American Society for Horticulture Science would probably be more like a systematic review or meta-analysis, because they have done so many research projects on them. But then you appraise the sources to see what the biases are, and then you apply your knowledge. So you place the plant in the sun, water it carefully so you do not get the leaves wet, and you wait for it to flower. So at the very end, you're going to assess at it, is the plant still alive 1 month later? How about 1 year later? It doesn't matter what your timeline is. You should constantly evaluate that until you know that that is reliable and best. So we are finished looking at evidence-based practices, and we will conclude for today.